Dr. Ed Zimmerman, the Dick Doc, coming to you from our accredited operating room here at Aesthetic Revolution Las Vegas. Today we're going to talk a little bit about when Mother Nature sends you a curve, or you go for broke. Let's talk about Peyronie's disease. So what is it? Do you need to fix it? And if you need to fix it, what can you do about it? Basically what happens is if there is a significant bend along the shaft of the pickle, fibrotic tissue can form, and that fibrotic tissue pulls to the side where the bend is. That fibrotic tissue can sometimes just be ignored, because if the bend isn't more than 30 degrees to the side, down, or for some guys, they're gifted and it goes up and it pleasures their partner because it hits the Grafenberg area, so that's not necessarily a bad thing. But for the curve that's more significant or causes pain or causes the pickle not to be totally elongated, there are things that we can do. We could go to your urologist and use something called Xiaflex. It's a collagenase that's injected along the fibrotic plaque to help dissolve that material. And then you keep the pickle in a splint for a while to try to get it to straighten out. Sometimes that works. Some days, older procedure would be to go in on the opposite side of the curve, because if we can't release this much, we can cause this side to fibrose down and it pulls the pickle back. The problem with that is it tends to make the pickle shorter, so probably not the best procedure that we have to offer for it. Then there are other things that we can do. We can mask a curve both with filler, the hack penis procedure, or we can use platelet-rich plasma, P shots, to try to help it stay straight. Doesn't necessarily dissolve the plaque, but it does help it heal if it's relatively recent. We can use acoustic wave therapy, so sound pressure waves that are designed to rupture the plaque a little bit and help the pickle heal more straight. We can pull the pickle on stretch with a penis pump. That's a legitimate thing. And you want to have a pump that has a quick release valve and that will pull the penis straight for a period of time, 10, 15, 20 minutes max, and then allow it to relax and then hold it straight, and other things that you can do like that. Now, also, you can hide the curve. So another possibility is to use something called the Penuma, P-E-N-U-M-A. That is a brilliant synthetic around the pickle device. It goes in surgically implanted under general anesthesia. It surrounds the pickle under the skin, and it provides an external cast to hold the pickle straight, or for guys who suffer from hidden pickles or buried pickles because they've got some extra tissue around the base of the pickle, this provides a way of splinting the shaft so it's always up, always available. You can even have relations with it even if you don't have a good erection. So lots of things that we can do if Mother Nature throws you a curve or breaks something. Now guys, remember, if you break something, particularly reverse cowgirl position is probably the most dangerous position out there. And for the guys who've had the dorsal penile ligament removed so the penis doesn't stay parallel to the body during relations, it can flop in any direction. It's possible with a little bit of energy to break the shaft, and that's a surgical emergency. That's one where you need to go to the hospital and have that pickle splinted, have the hematoma decompressed, or you can get that fibrotic plaque that causes the pickle to lean in the direction of the injury. That's called a Throckmorton sign, for any of you who remember that from medical school. Anyway, that's all a little bit about Peyronie's disease or syndrome and pickles and the straight and narrow of how we treat it.